Yes, you hope, of course, you can resume where you were, whenever that may be. Let's bring in Jane at this point, who can perhaps give us an overview of this. As Chief Executive for the UK Homecare Association, that's the professional association of home care providers, has the situation improved for those working on this front line? Good morning.
Good morning, Emma. I think the situation is changing every day. To begin with, staff absence was an issue. As Edith said, quite a few people were self-isolating, but quite a number of them have come back to work. And as Edith also said, quite a few clients have, like her, decided to suspend their visits as they're worried about the risk of infection. And in some cases, family carers, because people are not going to work, have stepped in to help. But we fully appreciate everything that you just said about the stresses and strains that can put on families, especially if they don't have the right equipment. What some people are doing, which is very effective, is live-in home care. So the care worker lives with the person and then can effectively self-isolate with them. And we've seen very low levels of cases of COVID-19 in that model of care. It's been quite a challenge to get local authorities and the NHS to think about that, but it is an option.
And how else are you trying to mitigate against this? Go on.
So, I was going to say the other thing, at the time that Edith was talking about, the guidance on personal protective equipment was different from what it is now. And the guidance in itself is quite a challenge because it does keep changing, and the availability of PPE is limited globally. So it's now the case that every care worker should be pretty much on every visit needing face masks and eye protection, as well as the regular PPE that they normally use, which are gloves and aprons and so on. The reality is that there isn't enough PPE to go round, and so we're trying to encourage Public Health England to consider a more risk-based approach. So if you know for sure that somebody hasn't got symptoms and nobody's been in, then you may be able to not have to wear the face mask. But as your previous caller mentioned, the difficulty in home care is knowing who has been in the property and who, if any of those people have got symptoms. So if the PPE were available, everybody would be wearing it all the time. And the fact that people are not always, it's simply because they can't get hold of it. As you've heard, that the NHS also are struggling. And in home care, it's been even harder. The care sector's been even more, had even more difficulties accessing the appropriate equipment.
And what about, are you seeing with carers, home carers, that they don't want to go to work? Are they talking about that? Because we've been talking about doctors and nurses throughout the programme.
Well, we absolutely understand and are sympathetic to the fact that many care workers are feeling concerned and anxious. And everyone is absolutely indebted to them for their dedication and compassion, and the way that many of them are continuing to support and care for people despite their own very natural fears. So in UKHCA, our main priority has been helping to address the concerns of care workers and their employers by trying to sort out the problems so that we have clear guidance about what PPE is required and when, that we have testing available for them and their clients. And although, progress has been made, there is much that remains to be done. We've been working this weekend with Public Health England and NHS England on ensuring that the guidance to home care workers is fit for purpose for the home care setting. And we've been very actively working to influence government to get a proper plan for PPE. And they have now got a plan. It just needs to be executed efficiently.
We're 4 weeks into this. Do you feel like you've been forgotten? That carers in a domestic setting, it's just sort of government getting around to it now?
Well, even in normal times, much of the media, public and political attention is on NHS hospitals. Recently, there's been an increased focus on care homes, but only because of a high number of deaths, very sadly. And together, there are just over 500,000 people in hospitals or care homes at any one time. But in contrast, there are over 10 million people being supported and cared for at home, either by family carers or by the formal home care sector. And I think, hospitals and care homes are easy for people to see, whilst a lot of home care goes on quietly behind closed doors in people's own homes. It would be, in our view, a far more intelligent strategy for the government to invest properly in home care and other community services, because keeping people safe and well at home helps to keep them out of care homes and hospitals, which right now are quite risky places to be. And they're also more expensive settings of care. So we're continuing to push to get home care up the political agenda and for a national social and healthcare strategy that recognises its value and places it centre stage.
But in terms of specifically right now, that it's important to have that bigger view, I accept that. Do you feel you've been forgotten?
Social care in general has played second fiddle to the NHS, and within social care, home care plays second fiddle to care homes. So it's been a constant struggle to get our items on the agenda and to be heard. And so, we welcome programmes like this, giving voice to the care workers and the clients and to all of the care providers that are really doing an incredible job out there. Honestly, we are amazed constantly by how many of them are still keeping going. And, the funding for home care is a really serious issue right now. The local central government gave local authorities an extra 1.6 billion to strengthen care for vulnerable people. And so far, not very much of that has reached care workers and their employers. And we're genuinely concerned about the ability of care providers to make April payroll, because they've incurred huge extra costs from the personal protective equipment and from staff absence and sick pay.
So the cost of personal protective equipment's coming out of that budget?
Well, that's the theory, but so far very little of it has come. We've recently conducted research amongst our members, and we've got data on 131 out of 152 councils. 30% of them have not even said anything about extra funding, not even to cover the rise in national living wage on the 1st of April, never mind the cost of PPE or staff absence and sick pay. So just to give you a feel, most home care providers in normal circumstances without a pandemic don't need face masks. So it's only for a relatively small number that is doing complex care procedures. So the face masks are a new thing. And before the pandemic, you could buy a face mask for about 12 pence each. Now they're selling for somewhere between £1 and £8 each. If you're a large provider and you need 50,000 a week or 600,000 a week, that works out at an extra monthly cost of between £200,000 and £2.4 million, even at £1 each, never mind £5 each. Where is that money coming from?
It's a very good question. Thank you for providing it. We'll see if we can get some answers. An insight there into the world of home care. You've heard how it plays second fiddle in terms of awareness to care homes, and that social care then plays second fiddle to the NHS. All of whom, though, those people working in that field, need some form of PPE. I'm asking you today, with the news that doctors and nurses have got the backing of the Doctors' Union and the NHS Confederation to not go to work if they don't have the PPE, they don't have the right equipment. What do you make of that? Thank you very much to Jane Townson there and Edith Monk. 0808 5909 693.